आज हामी सेट 2 को पार्ट 3 लिएर आइसकेका छौं र ढिला नगरिकन हामी डाइरेक्ट क्वेशनतिर लागौं। क्वेशन नम्बर 1 मा रहेछ, what is the most appropriate intervention for managing a patient with a deep vein thrombosis? Option A मा रहेछ, ignoring symptoms. Option B मा रहेछ, administering anticoagulant and monitoring for complications. Option C मा रहेछ, restricting fluid intake. Option D मा रहेछ, increasing physical activity. यसको सही उत्तर हो अप्सन बी। वेल, त्यसैगरी हामी क्वेशन नम्बर 2 मा हेरौं त। What is the primary purpose of using a patient's medical history in clinical decision making? Option A मा रहेछ, to reduce communication with patients. Option B मा रहेछ, to limit patient involvement. Option C मा रहेछ, to focus solely on physical examination findings. Option D मा रहेछ, to guide diagnosis and treatment planning. यसको सही उत्तर हो Option D, to guide and treatment planning. Well, त्यसैगरी हामी क्वेशन नम्बर 3 मा हेरौं त। What is the role of the recovery nurse in the operating room? Option A मा रहेछ, to document the surgical process. Option B मा रहेछ, to assist with surgical procedures. Option C मा रहेछ, to monitor and support the patient as they recover from anesthesia. Option D मा रहेछ, to manage sterile supplies. यसको सही उत्तर हो अप्सन सी, to monitor and support the patient as they recover from anesthesia. त्यसैगरी हामी क्वेशन नम्बर 4 मा हेरौं त। What is the most common type of anemia in the general population? Option A मा रहेछ, hemolytic anemia. Option B मा रहेछ, sickle cell anemia. Option C मा रहेछ, aplastic anemia. Option D मा रहेछ, iron deficiency anemia. यसको सही उत्तर हो अप्सन डी, iron deficiency anemia. Well, त्यसैगरी हामी क्वेशन नम्बर 5 मा हेरौं त। What is the primary focus of health promotion activity in a community? Option A मा रहेछ, to enhance the overall health and well-being of individuals. Option B मा रहेछ, to treat acute illness. Option C मा रहेछ, to provide specialized medical care. Option D मा रहेछ, to focus solely on the chronic disease management. यसको सही उत्तर हो अप्सन ए, to enhance the overall health and well-being of the individuals. Well, त्यसैगरी हामी क्वेशन नम्बर 6 मा हेरौं त। Which of the following is an important consideration when planning a patient's discharge from a healthcare facility? Option A मा रहेछ, limiting communication with the patient's family. Option B मा रहेछ, ignoring the patient's concerns. Option C मा रहेछ, ensuring the patient has a clear understanding of their care plan and follow-up needs. Option D मा रहेछ, focus solely on the medical treatment. यसको सही उत्तर हो अप्सन सी। वेल, त्यसैगरी हामी क्वेशन नम्बर 7 मा हेरौं त। What is a common sign of heart failure in older adults? Option A मा रहेछ, shortness of breath and edema. Option B मा रहेछ, increased appetite. Option C मा रहेछ, elevated blood pressure. Option D मा रहेछ, weight loss. यसको सही उत्तर हो अप्सन ए, shortness of breath and edema. त्यसैगरी हामी क्वेशन नम्बर 8 मा हेरौं त। Which of the following intervention is appropriate for managing a patient with chronic obstructive pulmonary disease? Option A मा रहेछ, restricting fluid intake. Option B मा रहेछ, increasing physical activity without limitation. Option C मा रहेछ, avoiding medication. Option D मा रहेछ, providing smoking cessation support and oxygen therapy. यसको सही उत्तर हो अप्सन डी, well, providing smoke cessation support and oxygen therapy. Well, त्यसैगरी हामी क्वेशन नम्बर 9 मा हेरौं त। What is the primary focus of end of life care? Option A मा रहेछ, to limit patient and autonomy. Option B मा रहेछ, to focus solely on curative treatments. Option C मा रहेछ to provide comfort and support to patients and their families. Option D मा रहेछ to ignore patient preference. यसको सही उत्तर हो option C to provide comfort and support to the patient and their family. Well, त्यसै गरी हामी क्वेशन नम्बर 10 मा हेरौँ त. What is an essential aspect of patient-centered care? Option A मा रहेछ limiting patient's involvement. Option B मा रहेछ involving patient in their own care decision and respecting their preference. Option C मा रहेछ focusing solely on medical interventions. Option D मा रहेछ avoiding communication with patients. यसको सही उत्तर हो option B involving patients and their own care decision and respecting their preference. Well, त्यसै गरी हामी क्वेशन नम्बर 11 मा हेरौँ त. What is the primary purpose of using a nursing care plan? Option A मा रहेछ to guide patient care and ensure continuity and quality of care. Option B मा रहेछ to document administrative details. Option C मा रहेछ to focus solely on medication administration. Option D मा रहेछ to limit patient interaction. यसको सही उत्तर हो option A to guide patient care and ensure continuity and quality care. Well, त्यसै गरी हामी क्वेशन नम्बर 12 मा हेरौँ त. Which of the following is a key consideration in the management of diabetes mellitus? Option A मा रहेछ limiting physical activity. Option B मा रहेछ ignoring patient education. Option C मा रहेछ monitoring blood glucose level and managing diet and medication. Option D मा रहेछ focusing solely on medication. यसको सही उत्तर हो option C monitoring blood glucose level and managing diet and medication. Well, त्यसै गरी हामी क्वेशन नम्बर 13 मा हेरौँ त. What is a common complication of untreated hypertension? Option A मा रहेछ dehydration. Option B मा रहेछ hyperglycemia. Option C मा रहेछ stroke. Option D मा रहेछ hypotension. यसको सही उत्तर हो option C stroke. Well, त्यसै गरी हामी क्वेशन नम्बर 14 मा हेरौँ त. What is the primary goal of rehabilitation therapy? Option A मा रहेछ to limit mobility. Option B मा रहेछ to ignore patient needs. Option C मा रहेछ to restore function and improve quality of life. Option D मा रहेछ to focus solely on medical treatments. यसको सही उत्तर हो option C to restore function and improve quality of life. Well, त्यसै गरी हामी क्वेशन नम्बर 15 मा हेरौँ त. What is an essential aspect of caring for a patient with chronic respiratory condition? Option A मा रहेछ providing education on breathing techniques and managing excavations. Option B मा रहेछ restricting fluid intake. Option C मा रहेछ ignoring medication adherence. Option D मा रहेछ limiting patient involvement in care. यसको सही उत्तर हो option A providing education on breathing technique and managing excavation. Well, त्यसै गरी हामी क्वेशन नम्बर 16 मा हेरौँ त. Which of the following is a common symptom of hypothyroidism? Option A मा रहेछ high blood pressure. Option B मा रहेछ increased energy and weight loss. Option C मा रहेछ rapid heartbeat and sweating. Option D मा रहेछ fatigue and weight gain. यसको सही उत्तर हो option D fatigue and weight gain. Well, त्यसै गरी हामी क्वेशन नम्बर 17 मा हेरौँ त. What is the role of the nurse in managing a patient with a complex wound? अप्सन एमा रहेछ to assess the wound, provide appropriate care and prevent complications. Option B, to ignore patient's discomfort. Option C, to limit wound care to bandaging. Option D, to focus solely on medication administration. इसको सही उत्तर हो ऑप्शन ए to assess the wound, provide appropriate care and prevent complications. Well, त्यसै गरी हामी क्वेश्चन नम्बर 18 मा हेरौँ त Which of the following is a common cause of falls in older adults? Option A, increased appetite. Option B, high energy levels. Option C, impaired balance and mobility issue. Option D, elevated blood pressure. इसको सही उत्तर हो ऑप्शन सी impaired balance and mobility issue. वेल त्यसै गरी हामी क्वेश्चन नम्बर 19 मा हेरौँ त What is an important consideration in the management of a patient with a cancer pain? Option A, limiting medication use. Option B, ignoring patient discomfort. Option C, providing effective pain relief and assessing the impact on quality of life. Option D, focusing solely on curative treatments. इसको सही उत्तर हो ऑप्शन सी providing effective pain relief and assessing the impact on the quality of life. Well, त्यसै गरी हामी क्वेश्चन नम्बर 20 मा हेरौँ त What is the primary purpose of immunization? Option A, to limit disease progression. Option B, to manage chronic condition. Option C, to provide emergency care. Option D, to protect individuals from infectious disease. इसको सही उत्तर हो ऑप्शन डी to protect individuals from infectious disease. Well, त्यसै गरी हामी क्वेश्चन नम्बर 21 मा हेरौँ त What is the primary focus of community health nursing? Option A मा रहेछ to promote health and prevent disease within a community. Option B, to focus solely on acute care. Option C, to provide specialized medical care. Option D, to limit patient interaction. इसको सही उत्तर हो ऑप्शन ए well to promote health and prevent disease within a community. Well, त्यसै गरी हामी क्वेश्चन नम्बर 22 तिर लागौं Which of the following is an important aspect of managing a patient with chronic pain? Option A मा रहेछ ignoring patient concerns. Option B मा रहेछ providing a comprehensive pain management plan and assessing effectiveness. Option C मा रहेछ limiting mobility. Option D मा रहेछ focusing solely on medication. इसको सही उत्तर हो ऑप्शन बी provide a comprehensive pain management plan and assessing effectiveness. Well, त्यसै गरी हामी क्वेश्चन नम्बर 23 मा हेरौँ त What is a common complication of diabetes mellitus? Option A, hyperlipidemia. Option B, hypertension. Option C, anemia. Option D, peripheral neuropathy. इसको सही उत्तर हो ऑप्शन डी peripheral neuropathy. Well, त्यसै गरी हामी क्वेश्चन नम्बर 24 मा हेरौँ त What is the primary goal of prenatal care? Option A, to monitor the health of the mother and fetus and provide education and support. Option B, to focus solely on the labor and delivery. Option C, to provide postnatal care. Option D, to manage chronic illness. इसको सही उत्तर हो ऑप्शन ए Well, त्यसै गरी हामी क्वेश्चन नम्बर 25 मा हेरौँ त Which of the following is an important consideration in the care of a patient with a terminal illness? Option A मा रहेछ limiting family involvement. Option B मा रहेछ ignoring patient's preference. Option C मा रहेछ providing comfort care and addressing emotional and psychological needs. Option D मा रहेछ focusing solely on medical interventions. इसको सही उत्तर हो ऑप्शन सी। वेल त्यसै गरी हामी क्वेशन नम्बर 26 मा हेरौं त What is the primary focus of midwifery care during labor? Option A मा रहेछ to ignore labor complication. Option B मा रहेछ to limit patient mobility. Option C मा रहेछ to focus only on the postnatal care. Option D मा रहेछ to monitor and support the progression of labor and ensure the safety of the both mother and baby. इसको सही उत्तर हो ऑप्शन डी। To monitor and support the progression of labor and ensure the safety of both mother and baby. Well, त्यसै गरी हामी क्वेशन नम्बर 27 मा हेरौं त What is the role of nurse in managing a patient with a mental health crisis? Option A मा रहेछ to provide immediate support, ensure safety and facilities, assess the mental health resource. Option B मा रहेछ to ignore patient distress. Option C मा रहेछ to limit communications. Option D मा रहेछ to focus only on medication management. यसको सही उत्तर हो option A to provide immediate support, ensure safety and facility access to the mental health resource. Well, त्यसै गरी हामी क्वेशन नम्बर 28 मा हेरौं त Which of the following is an essential aspect of managing a patient with chronic kidney disease? Option A मा रहेछ monitoring fluid and electrolyte balance and managing dietary restrictions. Option B मा रहेछ ignoring dietary needs. Option C मा रहेछ focusing solely on medication administration. Option D मा रहेछ restricting patient's mobility. इसको सही उत्तर हो option A monitoring fluid and electrolyte balance management dietary restrictions. Well, त्यसै गरी हामी क्वेशन नम्बर 29 मा हेरौं त What is the primary purpose of health education in chronic disease management? Option A मा रहेछ to focus only on medication management. Option B मा रहेछ to limit patient involvement in their care. Option C मा रहेछ to empower patients with knowledge and skills to manage their condition. Option D मा रहेछ to ignore patient concerns. इसको सही उत्तर हो option C to empower patients with knowledge and skills to manage their conditions well. त्यसै गरी हामी क्वेशन नम्बर 13 मा जाउँ Which of the following is an important aspect of pain assessment in elderly patients? Option number A मा रहेछ focusing solely on physical examination findings. Option B मा रहेछ ignoring patient reports of pain. Option C मा रहेछ limiting pain management to medication. Option D मा रहेछ using appropriate pain scales and consideration non-verbal cues. इसको सही उत्तर हो option D use appropriate pain scale and considering non-verbal cues. Well, त्यसै गरी हामी क्वेशन नम्बर 31 मा हेरौं त What is the primary focus of nursing care in the post-operative period? Option A मा रहेछ to monitor for complication and provide supportive care to promote recovery. Option B मा रहेछ to limit patient mobility. Option C मा रहेछ to focus solely on wound care. Option D मा रहेछ to ignore patient discomfort. यसको सही उत्तर हो option A well त्यसै गरी हामी क्वेशन नम्बर 32 मा हेरौं त Which of the following is a common sign of hypoglycemia? Option A मा रहेछ rapid heartbeat. Option B मा रहेछ increased thirsty. Option C मा रहेछ sickness and confusion, अप्सन डी मा रहेछ weight gain. यसको सही उत्तर हो अप्सन सी sickness and confusion. Well, त्यसै गरी हामी क्वेशन नम्बर 33 मा हेरौं त. What is the primary role of a nurse in managing a patient with heart failure? Option A मा रहेछ to monitor symptoms, manage fluid balance and provide patient education. Option B मा रहेछ to ignore patient needs. Option C मा रहेछ to limit patient mobility. Option D मा रहेछ to focus solely on medication management. यसको सही उत्तर हो option A to monitor symptoms, manage fluid balance and provide patient education. Well, त्यसै गरी हामी क्वेशन नम्बर 34 मा हेरौं त. Which of the following is an important consideration when providing care to patient with a gastrointestinal disorder? Option A मा रहेछ ignoring patient discomfort. Option B मा रहेछ monitoring for signs of dehydration and managing dietary needs. Option C मा रहेछ restricting fluid intake. Option D मा रहेछ focusing solely on medication administration. यसको सही उत्तर हो option B monitoring for signs of dehydration and managing dietary needs. Well, त्यसै गरी हामी क्वेशन नम्बर 35 मा हेरौं त. What is the primary purpose of health screening in preventive care? Option A मा रहेछ to manage acute illness. Option B मा रहेछ to detect disease early and provide timely interventions. Option C मा रहेछ to limit patient education. Option D मा रहेछ to focus only on treatment of existing conditions. यसको सही उत्तर हो option B to detect disease early and provide timely interventions. त्यसै गरी हामी क्वेशन नम्बर 36 मा हेरौं त. What is the primary goal of respiratory therapy for patient with chronic obstructive pulmonary disease? Option A मा रहेछ to focus solely on dietary management. Option B मा रहेछ to ignore patient needs. Option C मा रहेछ to limit medication use. Option D मा रहेछ to improve breathing and reduce symptoms. यसको सही उत्तर हो option D to improve breathing and reduce symptoms. Well, त्यसै गरी हामी क्वेशन नम्बर 37 मा हेरौं त. Which of the following is an important aspect of managing a patient with musculoskeletal injury? Option A मा रहेछ providing appropriate pain management and supporting mobility. Option B मा रहेछ ignoring patient discomfort. Option C मा रहेछ limiting physical activity. Option D मा रहेछ focusing solely on medication administration. यसको सही उत्तर हो option A providing appropriate pain management and supporting mobility. त्यसै गरी हामी क्वेशन नम्बर 38 मा हेरौं त. What is the primary focus of end of life care in terms of patient comfort? Option A मा रहेछ to provide pain relief and address emotional and psychological needs. Option B to ignore patient preference. Option C to limit family involvement. Option D to focus solely on curative treatments. यसको सही उत्तर हो option A to provide pain relief and address emotional and psychological needs. त्यसै गरी हामी क्वेशन नम्बर 39 मा हेरौं त. Which of the following is a common intervention for managing hypertension? Option A limiting physical activity. Option B ignoring dietary needs. Option C lifestyle modification and antihypertensive medication. Option D focusing solely on acute symptom. यसको सही उत्तर हो option C lifestyle modification and antihypertensive medication. त्यसै गरी हामी क्वेशन नम्बर 40 मा हेरौं त. What is the primary focus of patient education in diabetes management? Option A मा रहेछ to focus solely on medication. Option B मा रहेछ to ignore patient concerns. Option C मा to limit physical activity. Option D मा to provide knowledge on blood glucose monitoring, diet and medication. यसको सही उत्तर हो option D Well, to provide knowledge on blood glucose monitoring, diet and medication. Well, त्यसै गरी हामी क्वेशन नम्बर 41 मा हेरौं त. Which of the following is an important consideration in the care of patient with chronic heart disease? Option A, ignoring patient discomfort. Option B, monitoring symptoms and managing risk factor. Option C, restricting fluid intake. Option D, focusing solely on acute symptoms. यसको सही उत्तर हो option B, monitoring symptoms and managing risk factors. Well, त्यसै गरी हामी क्वेशन नम्बर 42 मा हेरौं त. What is the primary purpose of using evidence-based practice in nursing? Option A, to provide the best possible care based on current research and clinical expertise. Option B, to limit patient involvement. Option C, to focus solely on administrative tasks. Option D, ignoring patient preference. यसको सही उत्तर हो option A, to provide the best possible care based on current research and clinical expertise. Well, त्यसै गरी हामी क्वेशन नम्बर 43 मा हेरौं त. Which of the following is a key component of managing a patient with a urinary tract infection? Option A मा रहेछ focusing solely on medication. Option B मा रहेछ ignoring patient symptoms. Option C मा रहेछ limiting fluid intake. Option D मा रहेछ administering appropriate antibiotic and increasing fluid intake. यसको सही उत्तर हो option D. Well, त्यसै गरी हामी क्वेशन नम्बर 44 मा हेरौं त. What is the primary goal of patient-centered care? Option A मा रहेछ to involve patient in their care decisions and respect their preference. Option B मा रहेछ to limit patient's autonomy. Option C मा रहेछ to focus solely on medication interventions. Option D मा रहेछ to ignore patient needs. यसको सही उत्तर हो option A, to involve patient in their care decision and respect their preference. Well, त्यसै गरी हामी क्वेशन नम्बर 45 मा हेरौं त. Which of the following is an important aspect of managing a patient with a respiratory infection? Option A मा रहेछ restricting fluid intake. Option B मा रहेछ ignoring patient symptoms. Option C मा रहेछ providing supportive care and monitoring for complications. Option D मा रहेछ focusing solely on medication administration. यसको सही उत्तर हो option C, providing supportive care and monitoring for complications. Well, त्यसै गरी हामी क्वेशन नम्बर 46 मा हेरौं त. What is the primary role of a nurse in managing a patient with mental health disorder? Option A मा रहेछ to provide emotional support and facilitate mental health research. Option B मा रहेछ to ignore patient concerns. Option C मा रहेछ to limit communication. Option D मा रहेछ to focus solely on medication management. यसको सही उत्तर हो option A. Well, त्यसै गरी हामी क्वेशन नम्बर 47 मा हेरौं त. Which of the following is a common sign of dehydration? Option A, rapid heartbeat. Option B, increased appetite. Option C, weight gain. Option D, dry mouth and decreased urine output. यसको सही उत्तर हो option D, dry mouth and decreased urine output. त्यसै गरी हामी क्वेशन नम्बर 48 मा हेरौं त. What is an important consideration in the care of patients with prospective wounds? Option A मा रहेछ limiting mobility. Option B मा रहेछ ignoring patient discomfort. Option C मा रहेछ monitoring for sign of infection and providing appropriate wound care. Option D मा रहेछ focusing solely on medication administration. यसको सही उत्तर हो option C, monitoring for signs and infection and provide appropriate wound care. Well, त्यसै गरी हामी क्वेशन नम्बर 49 मा हेरौं त. What is the primary focus of nursing care in the management of a patient with chronic illness? Option A मा रहेछ to limit patient interaction. Option B मा रहेछ to focus solely on acute care. अप्सन सी मा रहेछ टु इग्नोर पेसेन्ट एजुकेसन, अप्सन डी मा रहेछ टु प्रोभाइड ए ongoing supportive monitoring symptoms and manage treatment plan. यसको सही उत्तर हो अप्सन डी, to provide ongoing support, monitor symptoms and manage treatment plans. Well, त्यसैगरी हामी क्वेशन नम्बर 50 मा हेरौं त. Which of the following is an essential aspect of managing a patient with cardiovascular condition? Option A मा रहेछ monitoring vital sign, managing risk factors and providing patient education. Option B मा रहेछ ignoring patient symptoms. Option C मा रहेछ limiting physical activity. Option D मा रहेछ focusing solely on medication. यसको सही उत्तर हो अप्सन ए, monitoring vital signs, managing risk factors and providing patient education. Well, त धेरै धेरै धन्यवाद हजुरहरू यहाँसम्म हेरिदिनु भएकोमा. पक्कै पनि हजुरहरू नयाँ क्वेशन नयाँ कुराहरू सिक्नु भएको होला र यसै गरी अरू धेरै क्वेशनहरू आउनको लागि र नयाँ कुरा थाहा पाउनको लागि सब्स्क्राइब गरिदिनु होला. धन्यवाद.